My name's Shelly. I have a degree in medical science, mostly in pathology and physiology, so disease and how the body works. And I'm currently doing medicine at ANU down in Canberra. So an STI is a sexually transmitted infection. You can contract them in quite a few different ways. So not just from having vaginal sex, but also oral sex. Some of them, like herpes around your mouth, you can contract just from kissing someone. And some of them you can also get from sharing needles and blood-borne diseases as well. So it ranges from fairly mild, just take one pill and it goes away, to fatal if you don't look after it. But it's quite important to keep an eye on it because they can also be asymptomatic, and that's probably one of the biggest problems, is that you can be passing it around and not even know that you have it. It's particularly a problem for women. A lot of the time men have symptoms and women don't. And that's why it's so important to get tested, because you might be giving it to your partner, to a number of people, to anyone around you without even knowing that you have it. So people who practice safe sex and always take the necessary precautions should definitely get tested once a year if they're sexually active. But if you're not practicing safe sex, or if you've got a new partner, particularly one who is not forthcoming with their sexual history, it's good to get tested when you first start having sex with that person, just to make sure that you're safe and that they're also keeping safe as well. I think it's really important, particularly because we're beyond the age where the big HIV campaigns scared a lot of people into using condoms and safe sex. And we're now at an age where a lot of people are a bit more frivolous with their sexuality, not necessarily in a bad way, but there are also a lot of people practicing unsafe sex because they think there aren't any consequences. And that's fine, that's your choice, but then you should be getting tested to make sure that you're not making yourself or other people sick. It's just important for your own health and for the health of everyone around you. I think so. I definitely think there is. Unfortunately, it's still something that people are embarrassed to talk about, even to their close friends a lot of the time. It certainly, in my experience, can take a few goes to make someone go get tested for an STI. Even someone who comes from a medical or a science background and appreciates the risks that they're taking and the potential risks of not getting tested. There's definitely a stigma around it, and I think more traditional doctors are still very difficult to approach with these problems because you do feel judged if you go in and say, I'd like to get an STI screen for whatever reason. I think the biggest barrier is definitely the stigma. Unfortunately, still it's a problem. And it just means that people just don't want to go. Even people who have symptoms don't want to go see a doctor about it because they're afraid of what's going to happen if they go in and say, I might have an STI, or I'm concerned. It's associated with sexual promiscuity. Negative connotations of that kind of thing are still around. The health of you and the people around you should be more important than that. But unfortunately, it's still a problem in society. It's really easy. You just go into your GP, say, I need to get an STI screen. It's a blood test, quick prick, take a little bit of blood and a urine sample, and you don't have to do anything else. They send it off, they test it, and they'll come back to you with results. It's super simple and really easy and cheap as well. People are always worried about the cost of this kind of stuff, but it's not expensive to get screened for STIs. You can get tested at free sexual health clinics without charge. There's one in every major city in Australia, at least one, if not multiple. You walk in. It's a free and confidential sexual health service. You can also call your GP and ask what their procedure is, if they can bulk bill that kind of blood test or a urine test. And if they can't, many GPs will be very happy to give you the information that you need to get this test for free. Yeah, I think it's definitely something that's embarrassing for people to talk about. And it shouldn't be something that people are uncomfortable with. It should be no more uncomfortable to talk about than your cramp in your leg or like your broken arm. It should just be a medical problem, but it's got this stigma, so it's still bad. A friend of mine has. This person took a lot of persuading to get tested. They already had symptoms, and even so, and with the knowledge that they had from what they've studied, they were very concerned about the stigma of going to get tested. Eventually they did, very easy cure for the problem that they had. And I think for them it was quite an eye-opening experience as to that it is very easy and you don't get judged for walking into a free clinic and getting tested. It's just another medical test, no one really cares. People should remember that it's not hard to get tested and that no matter how much you feel like you're going to get judged, doctors aren't allowed to pass your information on to other people. They have to do the test if you need it, and what you do with the results is up to you. And I think it's better to just be safe and not let yourself get sick than to worry about the stigma of what other people might think if they maybe find out that you're getting tested.